Remember back in 2020 and 2021 where we were experiencing mask mandates? Well, guess what? More of these mandates are now starting to return because people are actually showing symptoms of a sickness. For example, a sore throat, runny nose, a cough, maybe just sweating, things like that. And now restaurants, businesses, schools are all saying, nope, can't come here. Well, I'm going to break down what's going on, why experts are saying that over the next week, so 7 to 10 days, we are actually going to see a surge of additional illnesses and hospitalizations. But here's the big thing. How far are mandates going to go? Well, we're going to address that in today's video, but all I ask is one thing. It takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates. And now, let's begin. So yes, mandates are starting to return here in the United States. Now, over the past month, I've talked about how certain hospitals and health facilities in the state of California actually issued a mask mandate. So any patient, any visitor coming in had to wear a mask. Well, guess what? It's not a mask mandate that we are seeing now. All across the United States, we're actually hearing reports of mandates where restaurants, businesses, schools are all saying that if you come in with a symptom, they will actually turn you away. Just listen to this. This is a comment I received actually on Thanksgiving. No, the day after Thanksgiving, on Black Friday. This person says, and I quote, "I was just kicked out of blank restaurant." I'm not going to say the name of the restaurant, okay? But the person says, "I was just kicked out of blank restaurant for having a runny nose. It's 25 degrees outside, and I walked from my hotel to the restaurant. Of course, my nose was freaking running, after I came inside. This is crazy. But the manager said that the restaurant has a mandate that anybody showing any symptoms must be asked to leave." So this person, and I don't know where the hotel was or how close to the restaurant it was, but they're saying it was 25 degrees out, which during the Black Friday, there's many places in the U.S. that were, but this person says there's 25 degrees out. So of course, walking from their hotel to the restaurant caused them to have a runny nose. Okay, I get that. That's concerning. But again, you want to know why experts are concerned, why businesses are worried right now? Well, it's because of this. The respiratory illness season, it's beginning to ramp up. We are seeing more and more people actually come down with a respiratory illness. It's concerning. Some businesses, I've actually went to a business just this morning, and that business was closed. You know why? Because the people were sick. There was nobody there to work. So they were closed down. Now, I want to read a little bit of this to you. Okay, I want to read a little bit of this article right here to you. But before I do, I want to show you a couple things. Like this one. This article right here from Forbes, it says, H5N1 bird flu concerns grow. Are COVID mistakes being repeated? That's the other worry. That right now, health officials all throughout the United States are warning the American people that if you're sick, stay home. Okay? If you have a cough that continues just to linger, if you have certain symptoms, go get tested. Not just for COVID either. Go get tested for COVID. Go get tested for the flu. Go and figure out what it is that you have, because it's not normal if you continue to cough for weeks on end or even months on end. But look at this one. This map, it's from the CDC. It shows the latest rates across the United States. And I want to show you this, okay? Not because you need to be concerned here. I just want to show you this so that you get an idea of what we're seeing. So here in the central part of the country, that's where we see an increase in positivity rates. That's concerning, but why? Well, according to experts, they say that this part of the country, this is where people are a little more free. They're going around. If you're sick, don't really worry about it, right? Go to work, go to the restaurant, go to the hotel. You're perfectly fine. But in the other parts like Washington, Oregon, California, over New York, over in that area, where those parts of the country are a little more, well, reserved, a little more shut down. I want to show you something else. This right here says California map reveals counties with fresh mask mandates. This is from about a month ago. But I still want to read this to you. I want to show you this map, mainly because it's going to give you an idea of where we currently stand. Keep in mind that right now, California is the one state that is implementing this mandate that if you are going to go into a hospital or some type of healthcare facility, you need to wear a mask. Okay? Now, I want to just show you something. Okay? This right here, I'm not going to show you I'm just going to kind of give you an idea. Okay? Right here. It says, as of November 1st, mask mandates were introduced in the following California counties. Alameda County. It says, as per an order of the health officers of the county of Alameda and city of Berkeley, specified healthcare personnel were required to wear face masks at work from November 1st to March 31st. This is something that we've seen before. Again, it starts with a mask mandate from this period to this period, and for certain people. It also is in Contra Costa County, in Napa County. Those are both in effect as well. In Contra Costa, that one actually goes all the way through April. Okay, again, a little bit concerning. There's Santa Clara County. It says healthcare facilities in Santa Clara County, which includes San Jose and Morgan Hill, have had continuous mask mandates in place since April of 2023. It never got lifted. It's been continuous. Goes on for San Francisco County, San Mateo County, right? Many counties inside of California have these mask mandates. But again, I think it's interesting that it's more than just healthcare facilities. One person wrote to me and said mandates are returning. Not necessarily mask mandates, but schools, businesses, and restaurants have mandates that their students and teachers, employees, and customers stay home if they have an illness. This could be a cough, runny nose, sore throat, and so on. Here's what I think is interesting, though. I had somebody write to me. It was a comment, I believe, and it was probably the middle of November. It was probably the first to second week of November, and this person had to sit out. Okay. I believe actually it was the week right before Thanksgiving. This person had to sit out of their college classes, could not go to their college classes, which they had finals, couldn't go. You know why? Because they had a small cough. Something where they could just be sitting there, it's a little bit hot, right? Kind of stuffy, and right? Just trying to clear your throat. That's all it is. They said they were asked to leave and don't come back until the cough is gone. I thought that was interesting, but this person could potentially fail their classes if they don't get to retake these finals, could fail because they were told to go home because they had a slight cough, right? A little tickle in their throat. That was it. Interesting. Now, I want to ask you, are you seeing these mandates return? If you go into work, and it doesn't matter where you work, you go into work and your boss hears you coughing a little bit. You're sweating because, well, right, it's just a tough day, right? You're wearing extra layers that you probably shouldn't have worn, right? And you're sweating. And your boss says, you don't look like you're feeling too good. I think you should go home. And then they tell you, no, I'm not asking you. I am telling you, you need to go home. Get out of here, okay? We don't need to get the whole office sick. You need to go home. Have you been seeing more of that? Because I've been seeing a little bit of that. Again, I don't work in an office building, okay? I work for myself. I don't see people going home all the time, but I hear it. I hear people at schools. Nope, you got to go home. Sorry. I hear people comment on some of my videos or send me an email directly that, yeah, they've experienced that as well. That they don't work in the healthcare facility. One person, okay, he worked for waste management. Now, I'm not saying waste management does this, okay? I have no clue, but this person works for waste management, was told to go home so that he didn't get his partner sick. That was it. That was, again, keep in mind, one guy, or I guess the guy's partner, is in the driving the truck, and him is in the back picking up the garbage from the street, throwing it in the back of the truck. And he was told to go home so you don't get your partner sick who's inside the truck. Yeah, that's what we're seeing. So I just wanted to share this with you because right now a lot of people are concerned, well, are they going to be asked to go home and not be able to work? Well, I want to show you one last thing right here. Look at this. It says overall, the U.S. Centers for Disease Control and Prevention predicts that this season could be similar or even better than the last, but the peak rate for respiratory virus hospitalizations will likely be well above what they typically were in years before COVID. It says for now, though, COVID levels in the U.S. are nearly the lowest they've been since the start of the pandemic, and they're decreasing. That's good news. It says wastewater data suggests that flu and a respiratory syncytial virus, known as RSV, are also circulating at low levels, but emergency department visits for both viruses have started to rise. This normally happens right about the holiday season. It says historically, we see an increase in cases about a week after Thanksgiving, and how quickly they increase between then and the Christmas holidays gives us a better sense of the season. Exactly like I've said. It's about 7 to 10 days after Thanksgiving is when we see cases normally peak. Okay, they're on the rise. But here's the crazy part. Depending on what kind of illness, how quickly it's intensifying, that is what's going to give us a good indication of what the rest of the season is going to look like. So I will leave you with that. But if you have any questions whatsoever, please ask your questions down in the comment section below. Also, if you have any insight as to certain mandates that are going on in your area, let me know that as well down in the comment section below. But again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.